First of all, let me thank all the subscribers for their enthusiastic response to my videos. Hope to carry on the same in future as well. Painful sexual intercourse. Now, it's quite normal and natural for the female to have pain the first time she has sex. But if it persists, then there is something wrong. The most frequent cause of painful sexual intercourse is reduced lubrication in the vagina. And this happens in two primary situations. One is when the woman is distracted, not interested in sexual intercourse, as when the kids are growing up, there's a whole household to be seen, kids have to be sent to school, husband has to be catered to, and all these things take over the pleasure of sex. There's decreased lubrication and hence painful sex. The other indication where painful sexual intercourse happens can be understood by the fact that females take longer to get aroused as compared to men. Now, men unfortunately do not recognize this point, and as soon as they are aroused, they think it's all okay to start the physical activity without noticing that the female is not fully aroused and therefore not fully lubricated in the vagina. What are the symptoms of fully aroused woman? The nipples become hard, the breast becomes engorged, there may be a facial flush, labia majora, the outer lip of the vagina, becomes swollen, and there is a wet vagina. So when all these things are present, then it's all the right time to have sex. If this is ignored, as it is in many cases, in most of the cases, men do not pay much attention to foreplay. And in my opinion, foreplay is as important as the sexual intercourse, physical part of that. Therefore, an adequate foreplay is the need of the hour to prevent painful sex, especially in younger women. The second most common cause of painful sex is presence of infection of the vulva and vagina and the cervix. This is quite common in women when they have fungal infection. There is a curdy white or curdy yellowish discharge from the vagina, and then because of the inflammation, the sex is painful. It also happens in urinary tract infections, particularly when it affects the urinary bladder, because the bladder being inflamed, front part of the vagina gets very sensitive. These situations can be controlled quite easily. Lubrication problems can be controlled by men paying more attention to foreplay rather than just simply giving it no time and starting off before the woman is aroused. The second very simple thing to do is to get the lubricant from the chemist, freely available. Water-soluble lubricant is the one that is required, and that can sort out this problem. The problem about infection can be sorted out by getting it treated with appropriate antibiotics or antifungal agents. You will have to see your doctor for that, the gynecologist. The third most common cause of painful sexual intercourse is what is known as vaginismus. This is a psychosomatic disease. Psycho means brain and somatic means physical body. So it's a combination of both the physical defect and psychological assessment of the situation. What happens in this situation is that as soon as the penis is brought close to the introitus or the opening of the vagina, there is a spasm that's set up in the muscles and they're squeezed tight, preventing the entry of penis. What to talk of penis? Even a finger can cause this problem in women who have this vaginismus problem. And introduction of even a finger can cause immense pain to the woman, because the vaginal muscles become so tight that they refuse to relax and send pain sensation to the woman. This may have a basis of child abuse in cases where the family rules and regulations are very strict, and also in cases where there has been a rape in the past or mutilation of the area involved. Clearly, this requires psychological assessment and psychological management as well as a management of the local area. But it's a complicated problem and it needs expert counseling as well as expert gynecological interference. And therefore, the best person to see is your gynecologist who has dealt with such cases in the past. Vaginismus. The other reasons why a lady can have painful sexual intercourse are on deep penetration, when there's a presence of many fibroids in the uterus, or when there's infection of the tubes and ovaries, when there's pelvic inflammatory disease, as I mentioned earlier, when there is cystitis or infection in the urinary bladder, when the cervix is inflamed, or in a situation known as endometriosis, where the mucosa of the uterus, the cells that line the inner lining of the uterus, go outside the uterus and spread in the local area. Then also they can have painful sexual intercourse. Finally, in carcinoma of the cervix, cancer of the cervix, sometimes comes to light because there's painful on deep penetration. When the penis touches the cervix, there may be bleeding and pain. And some cases can be diagnosed on that basis. So ladies and gentlemen, those are the frequent causes of painful sexual intercourse. And now you know what to do in situations like that. What about men? Men also have problems at times. And the most common cause of painful sexual intercourse is a tight frenulum. Frenulum is a structure, but it's part of the skin that joins the red area of the penis in the back part of the penis. It's a very thin bit of tissue that goes and joins the back of the red area of the penis, known as the glans penis. This has got the maximum number of nerve endings, but unfortunately, in some cases, due to the micro trauma of the sexual intercourse, on repeated occasions, tissue becomes hard. Normally, it is very supple and can be lifted up from the glans penis. Now, when that occurs over a period of time, the skin becomes so hard that it starts to pull on the glans penis. If no care is made at that stage, the frenulum either separates out, and in case there's bleeding, or it causes severe pain during sexual intercourse. Treatment is simple. We do what is known as a frenuloplasty that needs to be done in situations like these. It's a minor operation where the attachment of the skin to the glans is proximal, which means the tension on the attachment is taken care of. The other common cause of painful sexual intercourse is phimosis, or severe narrowing of the terminal tip of the skin of covering the glans penis, known as the prepuce. When the skin is very tight and during forceful sexual intercourse, skin goes back, it causes a lot of pain because obviously it's a very tight structure and you're expanding it. There may be cracks that appear in the terminal skin, and so it's very, very common in diabetics. In fact, sometimes we diagnose diabetes because of the inflammation of the terminal part of the penis, which makes it difficult for the person to have sexual intercourse because of pain. Sometimes the skin goes back and does not come back to its normal position. This situation is known as paraphimosis and is an emergency situation. So all you fellows who've got tight foreskin, be careful that you pull the skin back after it's retracted. Don't leave it retracted because then it might cause swelling in the area, and then after that the skin doesn't come back. The solution to this is a simple operation similar to circumcision, and then the skin can be rolled back. Like in females, males also, infections can cause painful sexual intercourse. Apart from spreading it to the woman, it causes pain during sexual intercourse. Causes of infection can be herpetic, herpes, ulcers, gonorrhea, where there's a pus discharge, inflammation in the shaft of the penis, and consequently pain during sexual intercourse and after sexual intercourse. When there's ejaculation, it may be a very painful ejaculation, particularly in chronic infections like chlamydia infections, which can be there for quite some time. The treatment is simple. Treat with the appropriate antibiotics and anti-inflammatory, and soon it settles. During the time of infection, if you do want to have sexual intercourse, always use a condom so as to prevent transferring the infection to the female and also helping somewhat in controlling the pain during sexual intercourse. A word about condoms is very safe, thin, extra thin, anything that suits you and your partner. But rarely, they may be the source of allergy, and then the man has a painful sexual intercourse. So be aware of the fact that there may be an allergy substance the condom is made of. Then there's a condition known as Peyronie's disease. Peyronie was a gentleman who found out that in certain situations, certain persons, there is plaque, fibrous tissue that is formed on the shaft of the penis. The result of this is that the penis starts to curve, depending on the way the plaque is or the way the fibrous tissue is, starts to curve in that side. This may or may not be associated with pain. And the third thing that may happen is that there may be erectile dysfunction along with it. Its cause is largely unknown, but I'm seeing it of late very commonly, at least more common than I used to see in the past. The treatment is difficult, but there are some things that can be done for it. But if your penis is curving in a particular direction and you are having pain, then you definitely need to see a doctor, an andrologist, who may be able to treat it at an early stage and prevent further damage to the penis. Some of the uncommon causes of painful sexual intercourse are when a person indulges too much in sexual intercourse, as during honeymoon. The body does not get a chance to recover. The lubrication process does not get a chance to recover and produce more lubricant, and therefore the friction increases and pain during sexual intercourse may increase. Delayed ejaculation is another one that can cause painful intercourse because both the man and the partner keep trying to have ejaculation, which does not seem to occur. Then there are certain positions in which a man may have difficulty in introducing the penis into the vagina and may have painful sexual intercourse. Communication is the answer, and discussing it with the partner is the solution to this. Painful sexual intercourse can result in loss of desire and loss of interest in sexual activity. It must therefore be tackled at an early stage. Ladies and gentlemen, if you have any specific problem like premature ejaculation, like erectile dysfunction, like female sexual disorder, I've got videos on those issues which I've discussed previously. You may like to go through it for better understanding of your problem and management. There are some videos in this series where I have mentioned about what you can do to improve your own sexual health. Home remedies, home management. I think this will be most useful for you if you go through the earlier videos of mine. If you've liked my video, press the like button. If you have any comments to make, if you have any suggestions, please do make comments in the comment section. And yes, do not forget to subscribe to the channel for more information on sexual health. Till then, goodbye.